You are listening to the Body Charge podcast, and I'm your host, Sandy Sanderson. Welcome to the Body Charge podcast. Today's topic is how stress affects gut health. The symptoms of bloating and bulging belly with embarrassing gas and pain after meals, or reflux that burns your esophagus may be part of irritable bowel disorder, SIBO, ulcerative colitis, or even Crohn's disease. Collectively, they form a growing trend in Western societies, with much of the blame going to increasing stress levels. Stress affects the vagus nerve, the longest cranial nerve in the body and the one directly controlling the digestive tract. Even if you have a great diet, it may be that stress is letting down your digestive capacity, and that can have disastrous repercussions, including sleep problems, fatigue, and metabolic syndrome. My special guest today is Lea Dombrowski, holistic health coach and nutritionist specializing in gut health, hormone balance, fitness, and functional medicine. Through her own health journey of recovery, she has worked out a natural holistic approach that helps heal and bring back peace to the gut. So welcome aboard, Lea. Lovely to have you on the Body Charge podcast.
Hi, thank you so much for having me on. It's such a pleasure.
My first question is, why are gut disorders so prevalent today, and what are the common symptoms?
Yeah, that's a great question. I mean, there's just so many different reasons on why gut health is just kind of popping up nowadays. I think the first thing I would have to put out there is definitely the way our food is made and the way our food is processed, especially I know you're not from America, but over here in America, our food is very processed and they're adding all these unnecessary ingredients that really do affect our gut and they're not really considering, the food manufacturers, like what they're putting in our products and it is just kind of making us sick and then they treat that sickness with like medication and this
Yeah,
medication isn't really getting to the root cause, which can
yeah.
also cause a lot of gut imbalance. Me
I,
personally, the thing that caused my gut issues was being put on so many antibiotics. So even things like that, that's just kind of making our gut health and our overall health just worse and worse, especially over here in America.
I don't think Australia is very far behind that. We always
Mm.
tend to follow USA like a little puppy dog in many things. And it's probably a global issue as well, because all modern societies, I think, have moved towards this highly processed kind of a
Yeah.
diet, because people are having to work harder, have less time to prepare their food, tend to, fall back on what's quick and easy. And then that's the trap, isn't it? The quick and easy is the trap. So in your own experience, can you describe your journey as to where you were at and what the problem was, and then how you discovered how to fix it?
Yeah, I mean, I'll try to sum it up as best as I can. Like I mentioned, I was on so many antibiotics growing up and as a kid, and my parents weren't very educated on food, so I was not fed, properly. I was fed, the processed food growing up. So my gut kind of developed on like the processed foods combined with the things like antibiotics. It just kind of really caused a lot of havoc in my own gut and I kind of woke up one day and it kind of all like hit me in the face as it was building up and I had things like bloating, chronic fatigue, acne, constipation, like just all these symptoms where I was like, what the heck is even going on? And of
How old
course
were
at
you?
that,
How old
uh-huh.
were you about that time?
I mean, I had gut issues my whole life. Like the gut was always something, my gut was always sensitive, but when like the bloating kind of kicked in really hard, I was about 20 years old, and that's kind of when it like all hit me in the face, but I had like little glimpses of it as well like growing up, but at the age of 20, that's when I like would wake up and look 9 months pregnant from bloating and I had horrible fatigue and brain fog where I could barely function and I could barely move through life and my, mental health just got into a very low place because I was so inflamed, And of course, at that point, I wasn't looking at my diet and the way I was raised, and I wasn't very educated. And my first attempt to heal it was, the stereotypical doctors. And, all the doctors could tell me was that it was normal and that there was nothing I could do about it, or, maybe give me an antibiotic, which that was what caused the problem in the first place. And after about like 3 years of trial and error and just doctors completely dismissing me, I finally found, holistic health coaching and functional medicine. And it was just so relieving to finally feel like not dismissed and validated that, hey, like this isn't normal, but there is a way to fix it, and you do not have to live the rest of your life with these uncomfortable symptoms. Like to eat your favorite food and be so painfully bloated, like
Yeah.
there's a way to overcome that, and that's why I'm really grateful that I kind of stumbled upon holistic health.
Did you find that when you went through this inflammation of the gut, that it also affected how you experienced a period? Because I know a lot of women get even endometriosis or, heavy periods, or they have a lot of pain during that time of the month. So did you find that there's a connection of symptoms there with the gut inflammation?
Oh, 100%. For me, like, of course, I was also on birth control, stereotypical American, but when I came off of birth control, like when I was on birth control, I didn't have a period. So I went on birth control at the age of 16, and I only got started getting my period again after I healed my gut. So I didn't have a period for many, many years, which is super unhealthy and not normal. And when I was 16, I was like, oh, I don't have a period. Yay, like, but I didn't realize how like crucial having a period was for a woman, and how it's such a beautiful thing, and how when you have a period, it is releasing all these necessary hormones in your body. And that wasn't
Cleaning.
something,
Yep.
yeah, that wasn't something my body was getting. And I went years without a period, and healing my gut allowed me to like have a normal cycle again, which is insane that I didn't have a period for all those years.
Yeah, yeah. So isn't that incredible? So when you went into your studies and you started to get some answers to your questions about, what the problem is, what did you learn about the gut and the connection with the antibiotics? So we know we have a big microbiome. We have to have a healthy gut. We need a lot of different species of little critters who help us digest food. The good bacteria,
Mm.
the good fungi, the good microorganisms, and they come with a good diet. But if we don't start that way, it can get a bit difficult for people to switch it. And just adding probiotics may not by itself be the answer. Did you find that?
Yeah, I mean, in my own practice, I rarely recommend a probiotic because typically what people do will just grab a random probiotic they see like in the aisles at their local supermarket, and they're not really getting the probiotic their gut truly needs, and just kind of taking a random probiotic isn't really that helpful, and most of the ones on the market aren't like the best. So I really rarely recommend a probiotic. I don't think I ever have. I mean, I think they're super helpful and they're super beneficial, but they're really not gonna be the end all be all for everybody. You kind of have to figure out like what is kind of making your gut disordered in the first place, and typically like there's other more natural ways you can kind of start rebuilding that microbiome as opposed to probiotics, but sometimes they are necessary, and I if you do need them, you kind of need to do your research and not just take a random one. Make sure that it has the strains that are studied, like studied strains, and not just like random strains. And like typically some brands like will put like strains that kind of contradict
Yes.
each other.
Yeah.
And like so like when you take them, it's like
It's not
not doing
targeted.
anything. Yeah, it's not doing anything. So finding like customized support is definitely what I always recommend instead of
Yeah.
just taking a random probiotic or supplement or medication.
Yeah, I know some allopathic doctors in the mainstream, if they've
Mm.
had to give antibiotics, and there are some cases where it's very acute, and that may be a mechanism to just avoid an escalation into something really bad. But
Hmm.
afterwards, it's like kind of using a disinfectant on the gut, and we also kill the good gut bacteria. So some of those
Hmm.
doctors have realized, oh, it's important to repopulate the gut, but they
Yeah,
just send
of
people
course.
away to get their own probiotics,
Hmm.
not realizing how complex the system is, and that, people are flying blind a lot of the time without,
Yeah.
some good knowledge, and a practitioner that understands the system to help guide them. Because it's really, you wipe the slate clean, and how are you going to repopulate that area if you don't know the right mix and the right complementary type of microorganisms? And so, do you, when you have a client, do a series of tests to work out where they're at? Because, it can vary a lot between
Hmm.
individuals. How do you tailor make something to help someone? Maybe they've come to you with reflux, and, they had having difficulty digesting food. It's very slow moving in the digestive system, and things kind of pile up and blow up because of the lack of digestive capacity. And so we end up, I think I've used an analogy before of like a compost heap.
Hmm.
The food starts to ferment and decompose itself because not enough digestive ability to move things through. So how would you help someone like that?
Well, like you mentioned, everybody is different. So just like symptoms obviously like are super important. Like your symptoms really kind of do help like kind of determine what is going on with you. Like when someone comes and like works for me, for example, and they have, bloating and reflux, like you mentioned, like that's already giving some dings in my head, but I have to kind of confirm that with like functional lab testing, of course, and really seeing what's going on. So it's both like the testing and the symptoms that kind of tailorize that protocol. But I always like kind of nailed into people's head that the protocol and like the supplements are only one piece of the puzzle. I think a lot of people get like caught up in like what doctor I can go to, what supplement can I take and they kind of neglect like the other things like how they're eating, how they're sleeping, how their stress levels are. Like the harsh reality is in my case and a lot of other people's cases, like no supplement is gonna help you if your nutrition isn't great, if you're not sleeping at night. And that's honestly a thing that a lot of practitioners and people in my field severely neglect. Like when I was going through my gut health journey, most practitioners, even functional medicine practitioners, would just address the supplements, and it really just goes way beyond the supplements. Like, yes, supplements are crucial and you need them, but you also need that nutrition and that lifestyle and that mindset support. So that is something I really prioritize bringing into my practice because you truly need all of that to heal, not just the supplements. But back to your question, like if someone comes in like with that issue, I will like, of course, listen to them, get them tested, kind of see what's going on in there, and then kind of give them a protocol tailored to what the results in their test kind of gave back, as well as that nutrition and that lifestyle support.
Yeah, so you'd get an idea of their levels of
Hmm.
stress or how well they're coping with the stress. Because I
Yeah.
know in my own business, Elektra Magnesium, I deal with a lot of people who, haven't even realized they were under stress, and so move into a
Hmm.
chronic stress state. And they only realize that they've been under stress when they start using transdermal magnesium and feel the difference. And oh,
Hmm.
I must have gotten used to being stressed like that. And I think
Yeah.
that's quite common in society. But what happens is, as you said, pay attention to the symptoms, and the symptoms of stress affect the digestive system.
Yeah, of
And
course.
how
Yeah.
does the vagus nerve then not work properly because it's responsible for the digestive tract, and that whole system? How is the vagus nerve affected by the stress then?
Yeah, so I think a lot of people don't realize that like your gut and brain are so connected and they do have that connection. So when I think a great example of this is like when you're nervous, you kind of get the butterflies, you feel it in your gut, and that's because they are connected. And I think like it's because they kind of like form together and they work so hand in hand. So like a lot of the times when your stomach hurt, you'll be anxious. So like they're just so correlated. So a lot of that toxic stress kind of does go straight to the gut. And for me personally, a lot of the uncomfortable feelings, like the fear, the anxiety, like they all kind of live in your gut. And that is why they're so like interconnected, and like you kind of need to address both of them to truly heal on like all levels. And that kind of also kind of relates to like getting rid of people who aren't great for you and just getting rid of that stress and kind of healing from your trauma. Like all of that really did move like the biggest needle in my gut health.
Mm.
And it's so crazy like how when you're less stressed, you're less bloated. So that's just
Yeah.
a
And
lot of people
sleeping
don't
better
realize.
and sleeping better.
Yes, of course.
Because sleeping and rest is when things heal, clean, all of that
Hmm.
work is done during a relaxation phase. But when your adrenaline is pumping under stress, that shuts down because you've got to have the blood flow and the energy going to the limbs ready for action. And so in order to use the nutrients you're consuming better, we need to have those periods of appropriate rest, not just superficial, but really deep, restful sleep. And that's quite elusive for a lot of people these days. And you know, it's a catch-22. You know, if you go and take oral supplements, you're not digesting food very well because you're stressed. How can you get the benefit from the supplements if, you know, you're not getting the digestion happening properly? So most of the time it's in and out the back end, right?
Yeah, oh my
That's
God.
why we have a transdermal magnesium, which works really well for people because it gets them out of that revolving door and gives them a leg up. At least if you get more magnesium into the system, you've got mitochondria able to make your ATP, more electrical energy flowing, better electrolyte charge in the cells, and then of course combined with drinking adequate water, as you said, good
Hmm.
lifestyle, and it will help get a deeper sleep. And then it's a chain reaction, really. And you know, you've got to have a lot of plate spinning. So that's why I recommend people get some help from a qualified practitioner that understands the system, such as yourself. So functional medicine is really important these days
Yeah.
because we don't get enough tuition or don't get enough education about good lifestyle at school. We don't
No.
understand, as you said, we can grow up in a dysfunctional environment and just think that that's normal for a while. In the meantime, it's doing a lot of damage. Even though when you're young, you think you can bounce back, it catches up with you.
Yeah, definitely does.
So, how does you mentioned mental health before? How does the digestive system affect our mental health?
Yeah, so like when you have inflammation, like kind of mental health is like in itself can be inflammation of the brain. And inflammation like in your gut can kind of go to the brain since the gut and the brain are so connected. Like in my own experience when I was dealing with the bloating, like that really impacted the way I felt with the brain fog and the chronic fatigue and the anxiety. And it's just all this inflammation in the body that's kind of correlating everywhere, especially to the brain, because your brain just doesn't know what to do at that point. It just gets so overwhelmed. So they are so connected, and kind of addressing your gut, I've seen make huge strides in my own anxiety and depression journey. And of course, like other things as well, like kind of I love like meditation and breath work and going on walks and healing through other paths as well, but really getting my inflammation down kind of made me more able to start addressing my mental health and exploring those different avenues too.
Yeah, so we have to really understand what inflammation is, don't we? It's the immune system trying to deal with pathogens of some kind because the environment's become too acidic and promoting
Hmm.
more of the bad guys moving in. So then that triggers the immune system to try and get rid of them. And so you have an inflammatory response. So I think the idea with the lifestyle practices is to keep that pH level in the normal, which is slightly alkaline. So that prevents, doesn't promote the bad pathogenic bacteria moving in, and it does support the good bacteria that
Mm.
love that environment. So we have to be good caretakers of our little critters, almost like a farmer taking care of
Yeah.
their plants and animals.
Yeah, they are kind of like plants.
But well, it's a symbiotic relationship, isn't
Uh-huh.
it?
Yeah.
So we cannot survive without our good gut bacteria. It just doesn't work. That's how we've evolved. And so we need to understand that better, and then we can self-manage better. The idea is you want to avoid drugs and surgery and, all of
Hmm.
those artificial chemical things that, sometimes in a very, very acute situations, you have no choice but to go in that
Yeah.
direction. But the idea is to prevent and not have to go down that pathway. And there is always a good way when we pick the natural way. So just to finish up, in your normal protocols, so do you recommend organic foods, or what would be a typical lifestyle plan that you would design for somebody?
For lifestyle, that is really like the nutrition and the fitness and like just kind of ch simple changes. So like even something as simple as like being more present at your meals, like I'm always telling my clients to do that because a lot of the people we like to sit down at our meal, eat it within 5 minutes, not pay attention to what we're eating, and obviously that's going to really impact your gut. Having more balanced meals. So like I always tell people to really prioritize blood sugar balancing meals, and all that really is having a fat, a fiber, a carb, and a protein source at every single meal. That's going to prevent your blood sugars from spiking. And we don't want our blood sugar to spike. That causes inflammation and a lot of other
And
things.
acidity, yeah.
Yeah, so I always prioritize, the blood sugar balancing meals, the digestion tips, I'm always creating like fitness routines because we want to get our body moving. And then like
Oxygen.
everybody's nutrition protocol, of course, looks different because if you have, for example, candida or mold, I really try to avoid the sugars because that's kind of those
Feeds them.
things feed off the sugar. So
Yeah.
everybody's nutrition looks a little different, but it kind of consists of having that fat, the fiber, the carb, and the protein at every meal, prioritizing whole and nutrient-dense foods, of course, getting the nutrients in as best as we can through the fruits and the veggies. So everybody looks a little bit different, and of course, the supplements depends on what's going on in there, but
And try
really
and be
this,
in control
yeah,
of your food, right? Not so many,
yeah,
not eating out of a packet.
yeah.
Because if you look at the labels, they've always got chemicals in them. And taking that extra time to prepare really good nutritious meals is a different kind of a routine for a lot of people who may perhaps have thought it's not worth it. I can get it cheaper by getting an instant meal outside. But really, it's not necessarily helping your body to stay
Yeah.
well and age well and without degenerative disease.
And you can eat healthy on a budget. Like I always see people on Instagram like kind of comparing like, McDonald's burger to like burger made with Whole Foods, and they made it around the same price. I mean, with prices increasing, like it isn't that much of a price difference to eat whole and nutrient dense foods.
Yeah, you just need,
Sorry.
that's all right. You just need to, I guess, allocate the time. I think people are very time poor, but it's really important that you invest that time in yourself, or get a good partner that likes cooking to help you with that, working together.
Oh my.
That's your puppy dog. And I was going to say before, when you talked about eating at your meals in a relaxed state, um, not to have arguments at the table, because I find sometimes families, bring their frustrations of the day to the table, and that's not really
Hmm.
fair for the other people. So everyone needs to be respecting that, like a sacred space, that dinner table where you share a meal. It's a sacred space, and you give thanks. You thank the universe for the good nutrition that's going to supply your body with everything it needs.
Yeah, and I
Every
think my number one tip is just to be present at your meals. Most of the people like scroll on TikTok, watch a movie, like that can really impact your digestion. And of course, just chewing your food. Everybody likes to eat in a rush. I always say take 10 minutes out of your day and do like a little like 10 minutes just with your meal, being present, being tuned into your body, pay attention to how it's making you feel, and that is going to seriously tell you so much more than anybody else because your body and you truly do know the answers. You just have to pay attention. So just take 10 minutes with your meal to just pay attention and be with your meal.
Yeah, I love it. Okay, so we're about to finish up. Would you like to let people know where they can find you or get more information about what you do?
Yeah, so all my social media is pretty much my name, Lea Dombrowski, and that's Lea. Dombrowski is Dombrowski, and that's on Instagram, TikTok, YouTube, anywhere you can find me. I'm really active on Instagram. You can send me a DM, connect with me on there. I'd be happy to chat, answer any questions, and connect with this beautiful community.
Nice. Thank you so much. Have a good
Yeah,
day.
thank you so much. Bye.
I hope you liked this conversation and will share it with others. Let me know what you thought about it in the comments below. If you want to listen to other Body Charge conversations, click like, subscribe, the bell icon, and click all notifications. Subscribe to our newsletter to get updates on blogs, podcasts, videos, and magnesium special offers at electramagnesium.com.au. Relax, recharge, and recover.